Good evening, everybody. This is Missy Baker, and Happy New Year. I hope everybody has had a great start to January and had happy holidays. Just wanted to make sure that we started off at the meeting since it is being held virtually. If anyone is interested in signing up to speak but didn't have a chance to register in advance, they may sign up by putting their information in the chat box during the first 5 minutes of the meeting. So I just wanted to share that. So welcome. I wanted to start off with a roll call, and then we will get going. So hope everybody's had a great start to your year. So Dr. Batt, is he on? Jeff Broadway? Annette Desai?
Hey, Jeff's on.
Okay. Earl Ford? Meg Harkins, I think, is not going to be able to join tonight. John Laranzana? I thought I saw him on. John, are you there? You're on mute if you're talking, but I do see you.
There we go. I'm sorry, I'm talking, saying here, here.
Thank you, John. Jesse? Eunice?
Here.
Dr. Smith?
I'm here.
Megan Smith?
I'm here.
Dr. Moss?
I'm here.
And we have a new Board of County Commissioners joining us. David Williams, thank you so much. Welcome to our group.
Hello, everybody. Good to be here.
So great.
Hello, David.
Hello, hello.
All right, so I just wanted to start out our meeting with the Pledge of Allegiance. So everybody will join in. I pledge allegiance to the flag of the United States of America and to the republic,
for which it stands, one nation,
under God,
indivisible,
with liberty
and
Justice for all.
Thank you so much. John, would you do the invocation for us, please?
Okay, there we go.
Okay, there you go,
Sure,
John. Thank you.
Okay. Heavenly Father, we thank you for another year to serve our community and serve each other, Lord. Thank you for all that we have here in Union County and here in North Carolina. We thank you for your blessings and your grace, the grace to be here with each other and the grace to be able to serve, Lord. We ask that you help the people of Union County here tonight, whether they're here in the county or traveling, wherever they are. We ask that you look after everybody in our county and help us here as a board tonight to make decisions that help our county and enable our citizens to do better in their lives. We thank you for all these things and all the things yet to come, and we ask these in your name. Amen.
Amen. Thank you so much, John. All right, and I see that Jesse has joined. So Earl, did Earl join? And Dr. Batt. All right, we'll continue to move forward. Our next item is the approval of the agenda. So let me share my screen. All right. All right, can everybody see my screen now?
Yes.
Yes.
All right. Can you read it easily, or do I need to change anything with it? Everybody good? Okay.
Yes.
So I know that the minutes and stuff were sent out, so let's go back to those for the approval of minutes. Has anybody had the opportunity to approve the minutes?
Motion to approve.
I'll second that.
Okay, thank you. So that was John and Dr. Smith. Thank you so much. So the approval of the agenda tonight. Here it is.
I'd like to make the motion to approve the agenda.
I'll second that.
Thank you so much. Moving forward, I do not have any old business that I am aware of. Is anybody else aware of any old business that we have? All right. Well, we will move to Executive Director's Report. Michelle?
Yes, Missy, and everybody else, I'm actually in my car trying to get home to join the meeting where you can see me. But Missy, remind me of what my first item is. Is it the election of the chairman and vice chairman? Or
So
is it
It's the other one. It's the
nomination? Yes, so you'll all remember, and I think Commissioner Williams is up to speed, that you had selected a subcommittee to look at the applicants for the board. You had 3 folks who provided that subcommittee and interviewed the individuals who had applied, and then they have made have a recommendation to make to you tonight. So I'm actually going to ask a representative of that group, Dr. Broadway, I think you were on that, or Megan, or well, Commissioner Helms participated, but if one of you could provide an overview to the group on your recommendation so that we can take action on that item.
So Megan or Jeff?
Hey, so we were really impressed with everyone, but the recommendation that we'd like to make to the board is for Allison McCoon for our dentist, Amy Dickey for the consumer of human services, and we only had 1 spot available for the other person left, and we were really impressed with Brandy Smith, so we'd like to recommend her if the board wants to make a motion to approve.
I'll make the motion to approve adding Allison McMahon, Amy Dickey, and Brandy Smith to our board.
I'll second that motion.
All those in favor, I have to go down the roll. So Jeff Broadway? I wonder if we lost Jeff.
Point of order, real quick. The motion is to approve the whole slate and not each of the individual candidates. Is that what I'm understanding?
Yes. John?
Yes.
You approve?
I was just asking the question of if we were doing this individually or if we were doing the whole slate.
We were doing the whole slate.
I do have a question before we vote. If we're doing discussion, just out of curiosity, what were the criteria that were used to pick these 3 rather than any of the other candidates in their place?
So Megan or Jeff, y'all did the interview. Can you answer his question?
Hey, John. So we only had 1 opening for a dentist who applied, and we felt like she would be able to make it to the meetings and could contribute. And the same for Amy Dickey. She fit into the consumer of human services. And then Brandy Smith, there was only 1 spot available for other person's position. So we had to narrow the applicants down, and we came up with a consensus to recommend Brandy Smith to the board.
Yeah, I understand that. I was just wanting to know what set those 3 apart rather than any of the other 3, just out of curiosity.
Well, for the availability, what we had open for the dentist and the consumer of human science services, those were the only ones that were applying for those positions, and we felt like they would be able to contribute. And then for the other person, she just had more experience as far as helping out with human services and her background.
Okay, thank you.
Any other questions or discussion that anybody has?
Yes, this is David Williams. I'd be curious to know, does the Consolidated Human Services Board, do we have an operative definition that we use for consumer of human services?
So, David, this is Michelle. I'm going to answer that. I mean, the others can. I think they would follow what I have always considered a consumer or a family member is someone who receives one of the services that we provide as part of our agency, kind of complement of services, or that we fund. So that's really the definition that we've used as part of our normal practice.
And would those be service? Because since we're a Consolidated Human Services Board, I imagine would that include not just some of the conventional categories of service that we think of with DSS, but it would also include a number of services offered through public health?
So for us, it would be social services, public health, transportation, veteran services. We fund behavioral health services in the county. I don't know if I just said veteran services. I meant to. Veteran services. Any of the programs that fall under any of those services. So senior nutrition, transportation, any of those complement of services that fall under any of the directors that we have as part of the Human Services Agency.
And if I'm not mistaken, for the candidate that we're considering tonight for Consumer of Human Services, I'm trying to remember in the application I went through, I think she was an advocate or a parent, maybe an advocate for a class of consumers of human services. So is that typical as well, that parents or advocates, for those who consume human services would fall in that category also?
Yes, I think she works or volunteers with NAMI, which is the National Association of it's a mental health group. And then she indicated in her application, and I'm assuming in the interview portion, that she has, I think, children who receive services that would, qualify. And she may have some other services. I mean, it could be as broad as, if you're receiving a program out of social services, that you would also qualify as a consumer or family member.
Okay, very good. So it sounds like our operative definition is pretty broad when it comes to consumer of human services. And really my point in asking all this is, I think it seems like it would be a good thing to have, our vacancies filled. And to the extent we have folks that, meet the definitions, for these categories, I think a broad definition, seems pretty good. So thank you, Michelle, for clarifying that for me.
You're very welcome.
Hi, can I make a comment? This is Dr. Moss. In terms of the consumer of human services, I just noticed, I know at the last meeting that she had applied, but I've had some opportunities to actually consult with Amy Dickey. She's also a family partner for a mental health agency, and she's really good and she's really connected in the community. I think that's a wise choice.
Thank you so much, both of you. Any other questions or discussions anybody wants to have with these nominations? All right, so we will go down with the voting. So Jeff Broadway. We have made the nominations for Allison McMahon, the dentist, Amy Dickey of Consumer of Human Services, and Brandy Smith as the other person. So Jeff, you're on mute if you're talking. You might have a bad connection tonight. Earl
Can you
Ford?
hear me?
Yes, I can now, Jeff.
Yes, I am in favor of those candidates.
Okay. Earl Ford?
I'm in favor.
John?
Yes.
Jesse?
Yes.
Eunice?
I approve all three.
Dr. Smith?
Yes.
Megan?
Yes.
Dr. Moss?
Yes.
And Commissioner Williams?
Yes.
Thank you all so much. All right, Michelle, back to you.
Yes, and so you all, I think most of you are aware, but just to remind folks, because I don't know the last time that we made nominations, what will now happen is we'll have an agenda item for the Board of County Commissioners to take action on the recommendations that you're making for those appointments. So we'll put that on their next agenda, and then we will get in touch with those folks once the board takes their action, and Carla will get them going down the path of the training and getting them set up for the next meeting on all the things that she needs to do. So thank you for doing that and taking that action. The next item is as part of our customary practice is it's the time of year when we've selected chairman and vice chairman, and I think a third member to serve on any executive committee interaction that we need to have as part of the Human Services Board. So at this point, I would be asking you if there are any nominations for chairman, and then we'll move on to the next two slides. So any nominations for chairman of the Human Services Board for calendar year 2022?
So this is Missy, and I would like to nominate Megan Shaw as chair.
Thank you,
Is
Missy.
there a second?
I'll make the second.
Thank you, Eunice. Any other nominations? All right, with that, then Missy, do you mind doing the roll call vote for that nomination?
No, I'll be happy to. So
you.
for the nomination of chair for Megan Smith, we will go down the list. Jeff Broadway. We'll come back to Jeff. He's on mute, it looks like. Earl Ford.
Yes.
Can you hear me now?
Yes, I can hear you, Jeff.
Yes, definitely. Yes, in favor of Megan.
Okay, Earl, I got you. Yes. John.
Yes.
Jesse.
Yes.
Eunice.
Yes.
Dr. Smith.
Yes.
Dr. Moss.
Yes, absolutely.
And Commissioner Williams.
Yes.
Thank you.
All right, congratulations, Megan.
Thank you.
I will get in touch with you and we can have some further conversation about what this means, but we will. Now we'll move to the vice chairman. Is there any nomination for vice chairman?
Any nominations for vice chair?
I nominate Meg Harkins.
Every dollar you deserve.
So I think that she is not on tonight. She could not join us. So he has nominated Meg Harkins. She has been on our executive committee this year.
I'd like to second that.
All right, and we will go through the roll again. So Missy Baker, I agree. Jeff Broadway made the recommendation. Earl Ford,
Yes.
John Laranzana, you're on mute, John.
I swear. Yes.
Jesse,
Yes.
Eunice,
Yes.
Dr. Smith,
Yes.
Megan,
Yes.
Dr. Moss,
Yes.
and Commissioner Williams.
Yes.
All right, great. Michelle, you back on?
I'm back. And now we have the third position, which is just a member of the executive committee, which Meg Harkins had served this last year. This one does not take a ton of time. I will take nominations for the third member of the executive committee.
I will nominate Eunice McGee.
Missy, I think I'm going off this year.
Are you?
I'm pretty sure I am.
Okay. Any other nominations?
I'll nominate Dr. Smith.
Okay, is there a second for that nomination of Dr. Smith?
Second.
All right, any other nominations? Okay, if not, Missy, can you do the roll call vote?
You're on mute, Missy.
I'm sorry. Jeff Broadway,
Yes.
Earl,
Yes.
John,
Yes.
Jesse, Jesse, are you there?
Yes, I'm here. Oh, sorry. Yes.
Eunice, Dr. Moss,
Yes.
and Commissioner Williams. All right, thumbs up. So it sounds like our chair, vice chair, and executive committee next year will be Megan Smith, Meg Harkins, and Dr. David Smith. We see a happy family member. That's very sweet. Great. Anything else, Michelle?
That is it. Thank you all so much. I appreciate you volunteering. And Missy, I want to thank you for your work this year. I know it was more than you had anticipated early on, and you handled it with grace. And I appreciate how open you've always been and easy to get in touch with and follow up and make sure that we're doing things that we need to do. So we appreciate your time. I know you have a busy professional and personal life, and so you've really been an asset as we've worked through this past year. So with that, I'm conclude my executive director's items.
Thank you so much, Michelle. I definitely have a passion for this board, so I have loved being a part of it over this past year, although there has been some stressful times. Overall, it's been very rewarding. So love to give back to my community. With that, we will move to the division reports. So the first one that I have is Emily Colson.
Hi, everyone. All right, so I am here to give an update on the WIC and Senior Nutrition programs. Missy, can you allow me to share my screen?
All right, Emily, you should be able to share now.
Awesome, thank you. Okay, can y'all see my presentation?
Yes.
Thank you. Okay, so my name is Emily Colson. I manage the WIC program and also the Senior Nutrition program here in Union County. And I, first of all, just want to thank you guys for allowing me this opportunity to share with you all the great work that these programs do. And I want to share just a little bit about what we do, why it's important, and how we've changed over COVID and grown especially, and then some opportunities for the future. So first and foremost, what we do, and I'll start with the WIC program. So the WIC program is a supplemental nutrition program for women, infants, and children. And it provides access to healthy food through an EWIC card. And we also provide nutrition education, health referrals, and breastfeeding support. We serve pregnant women, breastfeeding and postpartum women, infants, and then children up to age 5. And there's a few ways to qualify. So a family would have to have a gross income of equal to or less than 185% of the federal poverty limit. Or if a family has active Medicaid, food and nutrition services, or if they receive temporary assistance for needy families, they automatically qualify for the WIC program, as long as they meet the category requirements, so if they're pregnant or an infant or child. And also foster children under the age of 5 automatically qualify for WIC. And WIC is a mandated service for the health department to have in-house. And WIC works. So there's been lots of studies done. WIC has been around since the 70s. It just celebrated its 50-year anniversary. So there's been lots of studies just showing the benefits of the WIC program. So first will be prenatal health. So pregnant participants who participate in WIC are more likely than those who are eligible but don't participate in WIC to have longer pregnancies. So longer pregnancies equals fewer premature births and fewer infant deaths. And then, so that's kind of due to a couple reasons, but the main ones is that they have access to healthy foods and nutrition education during pregnancy, which helps those outcomes. And then the other big piece of that is that pregnant WIC participants are more likely to receive routine prenatal care. Because like I mentioned, one of those benefits is referrals to healthcare. So that's one of the questions we ask all the pregnant WIC participants is about their prenatal appointments. And each dollar spent on a prenatal WIC participant actually ends up saving about $2.50 or so in Medicaid birth costs. And that's mostly related to that lower incidence of premature birth and infant death. And so infant feeding practices, women who participate in WIC are more likely to breastfeed than women who are eligible but don't participate. And they're also more likely to introduce solids as recommended, which leads to healthier eating later in life. And then finally, the last big one is diet and cognitive development for children. So the studies showed that children who participated in WIC had higher intakes of important vitamins and minerals, and that increase happened without a calorie increase, which showed that the nutrient density of their diet was better and not just that they were eating more food in general. And that improved nutrient intake leads to improved cognitive development, which makes kids more ready for preschool when they graduate from WIC at 5. And so here is our graph of how we've grown and changed over the years, the last couple of years especially. And there's a couple points that I wanted to bring your attention to. So number one was the start of FY20, when things were still pretty normal. And at that time, we were not meeting our assigned caseload. The state sets us an assigned caseload, and that's what we're funded based on. And if we don't meet that, our funding is reduced. But our challenge here was that it's recommended by the state that each FTE of a WIC nutritionist serves about 500 participants per month. And at that time, we had about 4.6. So based on our staffing level, we could adequately serve about 2,300 participants at that time. So we were extended, our staff was very extended at that point. So we put a lot of work into process efficiency improvements, and we were working with our QA team, and we were also working with DSS and our public health partners just to get the word out about WIC, and we worked on a referral process, and that's been really helpful in bringing clients into the program, and so that we can serve clients as efficiently as possible. The second point was the end of May 2020. So things were getting wild, and we got some COVID funding, and were able to hire 1 FTE of a contract with nutritionists. And that helped us kind of react a little bit to the increase that came with COVID. We still are serving about 125% of the recommended 500, but having that extra FTE really helped us respond and get clients in. At one point, I think we had over a 3-week wait. So that was just absolutely essential for us to have. And then the third thing, our caseload after the pandemic started and we were able to onboard that WIC nutritionist, it really stayed pretty stable, but it has been inching up and up and up, it seems like, each month. And the highest we actually served so far during the entire pandemic was just this past October. We served 3,530 participants. So it is not slowing down at all. Still slowly picking up. All right, so some challenges and future opportunities. One major thing that happened in March of 2020 was that USDA put in place some waivers, and the biggest one was for physical presence. Normally, the WIC program requires participants to make themselves present to get on the program and to stay on the program. They would have to come in normally every 3 months to keep their benefits active. And so the first waiver they put in place was to waive physical presence for WIC visits. And so far, that has been one of the most helpful things just in general. Even without COVID, we've heard from clients just how much of a challenge accessing us can be. So being able to do things on the phone has allowed us to serve this higher caseload and just be more accessible to participants who might not otherwise be able to get into our office. So we're not sure. We kind of would expect that if those waivers expire, which right now is set to be sometime in mid-April if it doesn't get extended, we would expect that we would see a decrease in that caseload that we're serving, which would be a challenge, of course, because we still want to reach those people. We know that they have benefited from the WIC program and need the WIC program, so we would still want to try to find ways to reach them. So there are some flexibilities written into the policy that we could take better advantage of than we used to before. So that's something that we would look at. And then another big opportunity that we'll have is that we were chosen to be a pilot for the state for telehealth. And they changed the policy to allow telehealth to count as physical presence. So that'll be a really big opportunity for us just to, again, be more accessible even when those waivers expire. And then our other big challenge, as I mentioned, is staffing. So currently we're serving 125% per FTE. So we're really stretching our employees. And that 125% is with that contract nutritionist. So currently we have that funded through March of 2022. And we've applied for American Rescue Plan funds. And if those don't get approved, we will be requesting to add that as a county funded position. And if that does not get approved, the biggest impact that we'll see is that we will have a tougher time serving our participants, and especially in a timely manner. So we'll likely see those 3 and 4 week waits again. And again, we'll see our caseload decrease, which in turn will lead to a funding decrease since we're funded based on the caseload that we serve. So on the opposite end of the life spectrum, we serve the seniors in Union County. And the senior nutrition program provides healthy prepared meals, both warm and frozen, at congregate meal sites and through home delivered meals, which you might be familiar with Meals on Wheels. So that's that program. And so we have 4 congregate dining sites. We've got 1 in Indian Trail, 1 in Mineral Springs, 1 in Marshville, and 1 in Monroe. And we deliver all over the county. And so in both of those areas, just want to give a shout out to transportation. They've been awesome partners for us in this. They're able to bring seniors to the meal sites. That top left picture is actually at our Mineral Springs nutrition site. So they have a chance to get together and socialize and just get out of the house and have a meal with other seniors. So transportation is able to bring them there, and they've also helped us deliver especially a lot of frozen meals, and they also deliver some of our hot meals. But also we rely on a lot of community volunteers. We have about 250 or so community volunteers who help us get those home delivered meals out to seniors. And just a plug, if anyone is interested in delivering those hot meals to seniors, we're always looking for volunteers. So you can get in contact with me if you'd ever be interested in delivering meals. But more than meals, we also provide Insure Plus drinks on a very limited basis. We also provide education, not only at the meal sites, but we also send informational packets home to the seniors who get the home delivered meals occasionally. We're also able to provide referrals, and I'll talk a little bit more about that later. And like I mentioned, and I'll talk a little bit more about later, it's just a social interaction piece. Like these fine folks at the Mineral Springs site, and also for the home delivered, each day or once a week, depending on the meals, they have an interaction with the driver, and they have somebody looking at them and making sure they're doing okay. And so we've also, let's see, okay, so we serve any Union County resident over the age of 60 and their spouse, regardless of the spouse's age. And then we also have some special eligibility for people under 60 with disabilities who would reside with somebody who's over 60. So we serve a few participants who are over 60 and their disabled child who lives with them, but might not meet the age guidelines. And in normal times, we would require participants to be actually homebound to receive home delivered meals. But with COVID and everything going on, we have a lot of seniors who don't feel comfortable at this point coming into the meal sites. And so we've made some exceptions over the last few years, and we'll home deliver to anyone who doesn't feel comfortable coming into the sites. So it's more than a meal. That's the Meals on Wheels tagline, is that it's more than a meal. And I just love that because it is so true. It's so much more than a meal. But first and foremost, it is a meal. We do deliver 5 meals per week to each senior who participates in the program, or the congregate sites are available 5 days per week. And that helps to decrease senior hunger and to just help make sure that they're getting some calories in their diet. But it is so much more than a meal. We have a social worker on staff that we were able to hire with some COVID grant money, and she's been awesome about connecting our clients to other services in the county. And she, for a while, was making comfort calls. So each month, she would call every single participant who was participating in our program just to check in and say, hey, how are you doing? What's going on? Can I get you anything? And our population is already more isolated than the general population. And then COVID happened, and it just really exacerbated that. So just having that point of connection and that person calling and checking made a huge difference for our seniors. And now that things are a little bit back, we got our sites open. Again, that picture in the middle is from one of our sites. They were doing a pumpkin creating activity. We did close down our the congregate sites from March 2020 until July of 2021. But we have reopened, and we're just making sure everyone's wearing their masks when they're not eating. And but we just felt it was really important to bring that social connection piece back. And let's see, the last big thing is the safety and well-being of our seniors. So one of the main goals of this program is to help seniors be more independent and safe in their own homes. So this Meals on Wheels little infographic here showed from their study that they did that just receiving Meals on Wheels decreased hospitalization rates significantly. It decreased emergency department rates and use of nursing homes. So it is effective in keeping seniors safe in their own homes, which is where we all want to be. Okay, and so here is a graph showing how we've grown over the last couple of years. So starting back in FY20, or actually I'm going to back up even a little bit more. Between FY17 and March of 2020, we served a pretty consistent and steady average of about 4,800 meals per month. And all throughout that time, and dating back to many years ago, we've had a wait list of normally between 150 and 200 seniors each month that were just waiting and not receiving anything. And they could be waiting as short as a couple months or as long as a couple years, just based on availability and especially funding. And over 2/3 of the seniors who were on the wait list when we were looking at the increase for COVID-related food issues, we found that over 2/3 of the seniors who were on our wait list reported being food insecure. So there was a huge need. And what I really want to stress is that need has been there. Just over the COVID period, we have received grants and different federal aid packages that have allowed us to implement the increase that you see here. So starting in April of 2020, that's when we really started partnering with transportation for our frozen meal program. So just instantly, we made the decision to wipe out our wait list and offer frozen meals to every single person who was on the wait list, just to get meals into their house. And so that's when you'll see the increase really start. And the increase, so the state requires that for each person that we serve, we have to do 2 assessments each year. So with the increase in meals and increase in client serve comes an increase in need for staff to help get those seniors enrolled in the program and to keep them maintained in the program, for us to stay in compliance. We could send meals out, but we would get in trouble at some point for not doing assessments. So in September of 2020, we were able to onboard our social worker. And so that has helped us really to maintain the level of clients that we're serving. But we've had special COVID funding pretty much very steadily since April of 2020 to serve seniors. But again, the need has always, it increased a little bit during COVID. We saw a little bit of an uptick in our referrals, but this need has always been here. We've just been better able to meet it with COVID funding. And so challenges and future opportunities. The need always existed and it's continuing to grow. So the little graph here on the side shows that by 2039, 50% of Union County's population is expected to be 60 plus. So that's a lot of people when you think about how big Union County is and how much Union County is growing in general. So the population is aging, but the funding hasn't necessarily followed. And again, it's kind of a cascading thing. So the increased amount of seniors will lead to an increased need for the program, which for us also leads to an increased need for staff to get those clients on the program, keep them on the program, and also to coordinate the volunteer piece of this. So the increase in meals and social worker, as I mentioned, right now are grant funded. Similar for WIC, we've applied for funding from the American Rescue Plan for meals and staffing. And if not approved, we'll be requesting county operating funds for both of those items. And if it's not funded, one of the biggest immediate impact would be those clients that we started serving frozen meals to that were our wait list would go immediately back on the wait list. So we would have to stop serving those seniors basically immediately. Which also means not only do they lose the food, but they lose the connection that they had to a social worker and the connection that they had to that meal delivery driver who was bringing them their food. So they would lose that source of social interaction and the food. And if the staff money was not approved, we would definitely struggle to maintain compliance with those mandatory program assessments. We just don't have the staff to serve those. Right now, we've got a little bit over 600 clients that we're serving, which would be a lot for. Right now, we've got a part-time admin and one full-time staff person, so it would definitely be hard for them to juggle that workload. And then again, if we didn't get that funding, we would lose the connection to our social worker. And we're actually proposing to transition that into a supervisor position just to help us kind of streamline everything and keep the volunteer management in our shop. We just recently took that over when Gloria Haney retired. And so if we didn't have this money for staff, we wouldn't be able to manage that, and we would have to ask that somebody else, help us out with that, which would impact their work. So we are very hopeful and just hope that we can continue to grow and serve the seniors in Union County who need these services. So again, thank you so much for allowing me to talk about these programs. I'll take any opportunity I can to talk about the great work that we do. So thank you, and let me know if y'all have any questions.
Thank you, Emily. I appreciate you sharing that information. Definitely a lot of great work. I'll have to say, when I saw some of your team on a TV news story not too long ago about really delivering the meals and what an impact that made, you know, how proud it made me to be a part of Union County just with all the work that you do. So thank you, thank you, thank you. I appreciate that, and definitely see the overall impact you've made in our community, especially with the Meals on Wheels during COVID and stuff, and seniors having a hard time to get out and about. Anybody have any questions for Emily?
I just had one comment. I didn't understand the decrease in hospitalizations that occurs to that degree. That was substantial and significant, and I think that's wonderful. And my only question is just wondering about the current food. I know food prices are going up a lot at the grocery stores currently and are projected to go up substantially this year. I mean, have y'all thought about that and how that factors into this on need?
Yeah. That's interesting. I hadn't thought about, I was going to say, luckily we have built into our contracts that they can only increase our prices so much, which is helpful for us, but it definitely impacts our seniors. Like I mentioned, you know, over 2/3 of them already had a hard time affording the food that they need. And that was before the prices started to go crazy with inflation. So I'm sure we'll see an even more increased need. Over the last couple months, we have seen a little bit of an uptick in the number of referrals that we've received. Nothing crazy significant, but definitely a little bit of a noticeable increase. So I'll be curious to see if that continues to go up the way it has been, if we'll see even more of an increase in those referrals.
Thank you.
Thanks again, Emily, to your team, and please pass that along that we really appreciate all the work that y'all do.
I sure will. Thank you.
Have a great night. I'm going to share my screen again. So we are going to move to Stephanie and her team now. So Stephanie, take it away.
Or not. Oh, all right. I'm having a little bit of technology issues, so I'm on the phone right now. But I did want to present to everyone our State of the County Health Report for 2020. I know you must be wondering why are you presenting the report from 2020? Well, basically, I'm just going to go through the timeline of when things are due and why the 2020 report is being reported tonight. So basically, and you can go to the State of the County report slide that's after the first one. Missy's going to forward the slides for me. So we complete a community health assessment every 3 years. Now it was on a 4-year cycle, but every 3 years. Our last one was in 2019. And that report, we actually do surveys, and we get secondary and primary data. So we do look at statistical information and so forth. We gather all that information together, and then we submit a report in March of the following year. So we completed the community health assessment in 2019, and we submitted it in March 2020. And then 6 months later, we have to submit community health improvement plans to the state. And those are based pretty much on our criteria that, or our focus areas that come out of the community health assessment. That was submitted to the state in September of 2020. And so then every year we do have to report our findings. So even though it seems like So again, we wrote the report for 2019. We submitted it in March of 2020. We did the community health improvement plan and submitted that in September of 2020. And then the state of the county report is due for the year of 2020 in March of 2021. And actually, they extended that deadline until June. So we didn't submit this report until June of last year, 2021, and we did not get comments or approval until a little bit later on. We also have a written report that I'm going to give everyone once we're in person, but you do have a copy of the report, which I know Missy flipped through at the beginning. So that is there for your viewing. I'm just going to present an overview of the report itself. The report, basically, we look at, in the State of the County Health Report, we look at progress we've made on the Community Health Improvement Plan. We look at the morbidity and mortality changes and rate changes. We look at emerging issues in the community, health issues, any new initiatives that may have come up during the year, and any initiatives that were paused. And so we're going to go through that. Again, the Community Health Improvement Plan comes out of priorities from our Community Health Assessment. And each of our goals must relate back to an indicator from the Healthy North Carolina 2030 indicators. And again, they are written 6 months after we submit the report. Missy, you can move on to the next slide. Our Community Health Improvement Plan, we have really 3 focus areas. We have mental health and substance use disorder, which are combined on this slide, and we also have access to care. And our overall goal for the mental health and substance use disorder focus area is that all residents in Union County are resilient, live in communities that support their mental, social, and emotional needs. And under each of the Community Health Improvement Plan focus areas, we have strategies, and I have them listed here. I'm not going to verbally talk through them, but just summarize that we are working on community education about mental health disorders and awareness of treatment options. We do have our behavioral health collaborative that works in the public schools. So we have social workers and therapists, and each of them we we're talking about working with the schools on vaping initiatives in terms of helping to get some additional and new curriculum in the schools around really the epidemic that's occurring with the increase in vaping in that population, and talked about different mechanisms to do that. And then we also were talking about developing a tobacco ordinance. So those were all written into our Community Health Improvement Plan. And some of those initiatives we had started at the beginning of 2020, pre-COVID. And so we wrote them into this plan. And I'll talk a little bit more about what we were able to achieve and, what we had to pause and so forth. Missy, you can move on to the next slide. Our Community Health Improvement Plan, our other area is access to care. And we know that people who live in rural areas and underserved areas have difficulties getting services, getting to services in the community. So we really wanted to focus on this area. We developed an access to, one of our strategies is to develop access to care committee to talk about some of the issues, also talk about, some prevention and education strategies, and then also to talk about transportation needs for the underserved community. Overall, we want all residents to have access to high quality, affordable health care and really have a medical home. Missy, you can move on to the next slide. So some of the progress that we've made on our Community Health Improvement Plan, again, we didn't write the plans and submit them until September, but some of the initiatives had already started prior to writing the community health improvement plan. One thing the state did was they went into a new system to put all these documents, put the community health improvement plan and update so that it's a living, breathing document that everyone could see on the state level and with graphs using results-based accountability system, and which is really cool. And that's something I can send and share with everyone. So we have all of our strategies in there, and we can look at progress toward each of our goals in there, and keep it up to date pretty much quarterly. And it's a live document that you can read and look at that. In addition to that, so other progress that we've made, we created a Healthy Union Advisory Coalition. I know I've mentioned that in our meeting before. And that group are community groups and members from healthcare, education, nonprofit, government, you name it, just looking at really at these community health improvement plans and putting them into actionable items. So we put that group together really so that we could focus on all of these focus areas and make sure that we're following through with the goals that we have put in our community health improvement plan. So that we created and started back in October of 2020. The Behavioral Health Collaborative continues to work within the schools, and I know that I know that they hired additional staff so that all the schools had additional social workers and therapists, so that work is continuing. And we did put out in 2020 some mental health and tobacco prevention media messaging out on our social media. So those are some of the things that we were able to make some really good progress on in our community health improvement plan. Again, even though that plan had only been together for a few months. But we're proud of the progress we were able to make, and especially since we had COVID going on at the same time. So next slide, Missy. In terms of morbidity and mortality rates, basically annually, the state puts together and updates the morbidity and mortality rates. And I put on this slide on the right-hand side just an overall summary that we had put in our community health assessment on some of these rates. And you can see that the reporting period is 2014 to 2018. Really, there were no updates from the time I pulled this data for a community health assessment through 2020, because I think because of COVID, the data wasn't pulled in October like it usually is. And that there was just a delay in pulling that data. So nothing really changed in terms of our morbidity and mortality rates, or at least the information we had. But we did have some additional mortality information and mortality rate information on COVID. So that was something new. And at the time that I pulled, again, this is 2020 information, the time I pulled the report from our dashboard, from the state dashboard, we were at a 0.95% mortality rate because COVID was something new. We hadn't reported on it before, but I did put this in here so that people could see that. And then our rate was definitely a bit lower than the North Carolina overall mortality rate of 1.32%. Missy, you can move to the next slide. So COVID, of course, really became the major focus of 2020, and certainly put some issues emerged because of COVID. As everyone knows, school was online for the kids in 2020 from March to through the end of the school year, and even at the beginning of the school year, the kids were going 1 to 2 days a week, some 2 days a week, some were remote. So there were certainly some disruptions in the way that school was delivered and social support and networking structure. There were some financial hardships that many individuals and families faced due to some workforce closures, layoffs, work reductions. We saw that especially was impacted in the restaurant industry and some of our small business owners and shops, and so many places and so many businesses were affected in 2020 due to COVID. We saw an increase, or there were definitely impacts on social use disorder, substance use disorders. I'm sorry, and even on some mental health conditions during COVID because of that social isolation. There was certainly a decrease in physical activity and a nutritional impact, which impacted chronic diseases. And there was a decrease in dental health and some other prevention services in the community just because of availability had decreased due to COVID concerns and having to put some safety measures in place. So COVID did impact a lot of these things, and we saw some of these issues emerging in the community. Missy, you can move to the next slide. So on the other hand, we had some new initiatives that kicked off during the year of 2020, some as a result of COVID and some not. The health department took on contact tracing in 2020, and first we started with the Incident Command Center and tracking COVID cases, and of course contact tracing started. We also, toward the very end of 2020, and I really think the first vaccine clinic may have been the very beginning of January 2021, but we did have vaccine clinics. We had big clinic hours that, we had some big events at the Ag Center and we do continue to provide vaccination, and of course in the community, at the health department, but we have done vaccine clinics, and they did start there, and we've gone out into the community and collaborated with Atrium and several other partners to provide those clinics. So that was the new initiative that was started in 2020. In addition to that, we implemented a new food council in the community. I was actually assigned to be the feeding coordinator for the county, and reached out to a bunch of the different churches, some nonprofits, restaurants, and so forth that were providing meals to community members and residents who were in need of food, and realized that there wasn't a whole lot of conversations going on between the different organizations, and the need for us to be able to collaborate together and coordinate services better. And we pulled together and started having conversations and putting some infrastructure together for a food council, which most counties, larger counties in the state have food councils, and we did not have one. And we wanted to also work more closely with farmers and economic services. And again, just making sure that the food supply and demand were where it should be, and initiated that council. And one thing that I had to do was report weekly. First it was weekly, then it was monthly, to the state, just how many meals were served in the schools, in our through our senior nutrition program from our larger meal providers, just so that we could report those numbers, because the state was tracking that information. Again, just making sure the food supply and demand was where it needed to be. And we've continued those efforts actually into the next year as well. And then, like I mentioned, we did develop the Healthy Union Advisory Coalition so that we could continue to monitor all of our community health improvement plans and all our initiatives in the community. So those were some of the larger initiatives that we started in the community. And Missy, you can go to the next slide. There were some other, in environmental health, there were some larger services and initiatives that were started as well. There are a few COVID-19 services that I know that environmental health did. They implemented a lot of the executive orders at facilities that were mandated. They investigated outbreaks in congregate living facilities and worked with communicable disease nursing teams and provided some guidance on disease prevention, cleaning, disinfecting, ventilation systems. And also they investigated complaints related to COVID-19, some that came in from people and restaurants and so forth. So that was a big thing that they took on this past in 2020. They also initiated Clean Water for Carolina Kids program. And that one really focused around drinking water and licensed childcare facilities and the lead levels. And I know environmental health started providing technical support and water testing at some of those centers. They also worked with Chapel Hill and the Clean Water for North Carolina program on well water research and engineering, and identified improvements in well construction practices and lower cost treatment for arsenic and other co-contaminants. And last, they also worked real closely with the Safe Kids Committee and other community members to decrease the number of deaths resulting from poison-related incidents. I know environmental health provided educational materials and Operation Medicine Drop information at child care centers, and also distributed pool safety materials during inspections. So those are a few things that the environmental health unit provided. And last but not least, on the last slide, I just want to talk about some of the initiatives that we paused during, Missy, you can move on to the next slide, that we paused during 2020. So when COVID hit, we were about to relaunch our Health Equity Committee. That committee had been a standing committee since 2019, or actually the end of 2018. We provided a lot of educational information in that committee, and we were just about to launch a whole new face to that program, and we had to put that on hold just because our resources were real limited. At the time, due to COVID, we were kind of pulled in different directions, so we paused that. We also took a pause on our tobacco ordinance, which again, I know you just heard about a few months ago, and we're bringing that to the board in a couple of weeks. But we had put that on hold. We had been moving ahead with our ordinance initiative, and our goal was to bring it to the county commissioners in May of 2020. But again, focus on COVID kind of steered us away from being able to do that. We just didn't have the resources to do that, and it wasn't the primary focus. Our primary focus. We also were working real closely with the schools on. Again, we were working on a curriculum. We were working also on bringing a student speaker into the schools in the fall of 2020 to talk to students in assemblies at the middle schools and talk about vaping. And we were going to start some peer mentor programs with Wingate University in the schools. Of course, the schools were not open fully and had different focuses as well. And a lot of that was on remote learning and teaching and trying to make that work. So we did put that on hold. And again, luckily that has picked back up again at the end of 2021. So I'm happy about that. And I'll be reporting about that when we do the 2021 such information. But we had to put that on hold. And then last, we were about to kick off a minority diabetes initiative that we're collaborating with Cabarrus County on, and we were going to start by bringing that into actually the health department, into human services, and we had a cohort all ready to go, but then again we had to put that initiative on hold, and we are working now to bring that back. So, you know, a bunch of initiatives had to be paused, but they didn't disappear completely. And again, you know, we did have some really great new initiatives and made some progress over 2020. That's all I have to share from our community, our State of the County report. And again, you do have an electronic copy of that report, and you will be getting a physical copy of that report. I'm not sure if anyone has any questions.
Yes, I have a question.
Okay.
Well, Stephanie, thank you so much. That was quite a bit. And I just wanted to know if I'm not even sure if this is doable or if you ever even thought about it. But the question is, has there been any type of thoughts or about strategies or initiatives as far as the mental health, maybe interventions with law enforcement?
You know, that issue actually hasn't come up as a concern, but that is something certainly the community could look at in the future.
Okay, well, thank you.
So Stephanie, I know this is the year for our community health assessment. How do you think it's going to change from where we were a couple of years ago, now that COVID has kind of been around for almost 24 months?
Great question. So you just brought up a great point. We are kicking off our surveys for 2022 community health assessment, and we will definitely, and also focus groups. So we'll do some focus groups and with targeted populations. And it will be interesting to see. I'm sure that the mental health and component and substance use disorder component will probably, I'm thinking all these may stay focus areas. I really don't know if we've been able to focus as much on all the areas as we would have liked to over the last couple of years. And but you know, we'll see after doing some additional research and hearing what the county residents have to say. They feel that the focus needs to be on.
Well, thank you to you and your team. I know that y'all spend a lot of time on that work and really working on what's most important to our community. And so I just thank you for that.
Well, thank you.
Any other comments or questions for Stephanie? All right, hearing none, I think we will be moving over to the COVID-19 update. So Dennis, I think you're going to take the screen at this point.
Okay, thank you. I will share my screen. Okay, hopefully everyone can see that. I appreciate the opportunity to give another quick update. The first thing I'll say is that obviously I don't need to indicate that we are in a high surge of cases here in not just Union County, but certainly the region and in North Carolina and across the U.S. I mean, the media has covered that quite well. The Omicron variant has been quickly impacting our community. And as you can see in this average new daily cases that we're seeing in Union County, it has skyrocketed. We now are averaging over 400 or right at 400 cases per day, or that was this morning and of this afternoon. we're over over 400 average new cases a day in Union County. You can see from the peaks that we had back in the first surge, back in the January of 2021, which was a large surge, and then we had another surge in September and early October. But this particular surge has been unprecedented, and many epidemiologists recognize that this probably has been the most explosive surge in cases that we've seen in the U.S. in our history. So another sort of historical moment as it relates to cases. Just looking at cases. This shows sort of our regional view of both cases and test positivity and cases per 100,000 population. This is data that's collected by the state, and we pull some of that to look at neighboring counties. And you can see here that particularly test positivity has been growing pretty rapidly. Just to give an indication, the goal is to try to have it at 5% or below, which kind of indicates a level of manageable transmissibility in a community. So 5%, we're a long ways from that. We're the highest we've ever been in the state, as well as in the region and in our county. So certainly a lot of cases, and it's increasing rapidly as of this afternoon. This information was from this morning, and as of this afternoon, our test positivity is now over 30%. So it's continuing to grow. Looking at average new daily cases by month gives you a pretty dramatic indication of what January looks like to date. Now, obviously, we only have 10 days in the month of January, so it's still not a true indicator of what the month is going to look like. But if the pattern holds true at where we are currently, you can see we're at a really an unprecedented level in terms of average daily cases that we're seeing. Test positivity, as I mentioned earlier, it continues to be high. The bar chart here shows the level of tests or the number of tests that are being done and reported from the state, and we're still, seeing a lot of tests being done in the community, and so a lot of activity. It's also become challenging in getting testing because a lot of been a backlog in getting a lot of test kits. So particularly for rapid tests. So it's testing is very, very busy right now, but it's also a high percentage of them are coming back positive. Deaths have remained pretty steady, which is one of the things that we've indicated or we've been hearing from other researchers around the Omicron variant, that it's extremely transmissible, 2.5 to 3 times more transmissible than Delta, and Delta was considerably more transmissible than earlier variants. So that's why we see the huge surge in the number of cases. But as we tend to see, and we're sort of playing out, that it's does tend to be, for the most part, milder in its severity, and so that's a good thing. And while that's a lagging indicator. And so for December, it's not a real good indicator of what we're going to be. But just looking at November, December, we didn't see a really big increase at that time, and are not seeing huge increases in that early part of January either. So it's certainly good that it's not not transferring yet, at least in terms of having the same kind of impact with death as it is for just the raw cases themselves. Another concern that we all have is the impact on hospitalizations. This is a chart that looks at the regions across North Carolina. The pink line is the Metrolina Healthcare Preparedness Coalition, which is the region that we're in, sort of the Charlotte Metro and the surrounding counties. The blue line near us is the Triad, so that's the Winston-Salem, Greensboro, High Point sort of communities or counties. And so you see that hospitalizations were pretty flat all through December, and then most of the region saw a pickup in terms of hospitalizations beginning at the end of December, and then certainly the first week or so of January saw an increase as well. In terms of severity of hospitalizations, while we've seen increasing hospitalizations, there has been, as you see with this slide showing adult ICU patients, it has also picked up some, but does not have quite the same trajectory as obviously the cases themselves are across the region, which is a good thing. In terms of vaccinations, there's not been a lot of changes from the last time we chatted. Certainly, in I guess it was the November meeting, we are currently in terms of fully vaccinated population at almost 54%, which is better than most of the counties, except for Mecklenburg and obviously the state, but certainly better than in some of the other regions, counties. There have been a few changes and updates as it relates to vaccines, and I'll just point out a couple of these. I know this is a busy slide, but I'll just point out that boosters has become a big point of discussion, and one of the changes that recently has happened is the boosters are now recommended for folks who are, it's been 5 months since they've received their second shot of the Pfizer vaccine or Moderna. And it was 6 months, but now both for Moderna and Pfizer, it's for 5 months. And Johnson & Johnson, it's for folks who have been vaccinated at least 2 months since their initial Johnson & Johnson vaccine. Also, there's recent recommendation from the CDC for booster shots at for the Pfizer series for booster shots after the completion of the Pfizer vaccine for those age 12 and older. So that particular vaccine is now, the boosters are available for that younger age population from the most recent CDC recommendation. Again, this is a busy slide, and I'm not going to belabor all the elements of it, but one of the other changes that has occurred recently, between Christmas and New Year's, was a change in the quarantine guidance. And currently, for folks who are exposed or may not be up to date on vaccinations, the quarantine time period now is for 5 days, and then an additional 5 days of wearing a mask, but could actually go back to work or go to other activities or normal activities, with those other precautions being taken up until day 10. And also, if you were exposed and are up to date on your vaccinations, or if you've had a confirmed COVID case within the last 90 days, it's not necessary to quarantine. They do encourage getting tested after 5 days of the exposure, but quarantining is not necessary at that point. Obviously, monitoring symptoms is still important, and wearing a mask for 10 days when you're around other folks, but it certainly reduces the time frame of that quarantine from what it had been, which was up to 14, and then it had the modified quarantine period of 7 to 10 days, depending on testing. But this change for quarantine reduced the time frame quite a bit, most recently from the CDC, and North Carolina Department of Health and Human Services has embraced that reduction in the quarantine guidance as well. That also goes for isolation. If someone's tested positive, stay home for 5 days, and then you can wear a mask for the remainder of the 10-day time period. But it's been a big change in the guidance from the CDC. That's all the slides that I have. I'll just point out that I think one of the things that we all recognize here with the large cases and the large surge that we're in, there's a lot of indication in looking at other countries that many of those countries that experienced surges prior to us with Omicron saw really steep climbs, and then they also saw pretty quick precipitous decreases after that. So I think we're all in for, kind of an interesting next couple of weeks in terms of trying to find out where the peak is. And there's a lot of folks, researchers and other epidemiologists, saying that we should likely see that, in the coming weeks, and then hopefully start seeing that downward trend that we're all waiting for. I think it's it's kind of telling also that this may be sort of the mark of us moving to that phase where we're needing to kind of learn to live with it. If you're sick, stay home. Certainly monitor symptoms, but with the fast spread, it's really impacting a lot of people. And I think one of the biggest things that's the take-home message for us is the disruption as it relates to workplaces and operations, things of that nature, because at least from the county's perspective, there's a large number of people who are still impacted with COVID, and at least for that 5-day period. While it's much shorter, and which that part is good, it still is it is disruptive for that period of time. So I think that's something that we're seeing folks having to adjust to, maybe more so than we did with the earlier variants. But right now we're still on the roller coaster, and it's hopefully we're going to be seeing a peaking in the coming weeks. Certainly happy to help answer any questions.
Thanks, Dennis. Appreciate that. I hate to see how it's increased, but I agree. Hopefully we'll hit peak soon, and then we'll have a drastic drop. So does anybody have any questions or comments for Dennis?
I do, just to seek maybe some clarification. This is John. Hey, Dennis, how are you?
Good, John.
Hey, I was hoping that maybe you could help me out to understand some things and maybe provide some guidance. So I was at a board meeting for Union Academy on Thursday, and we have recently gone mask optional over at Union Academy. After as we discussed in the beginning of the school year, that we were going to do this on a month-to-month basis and be pragmatic about it. People have had their opportunities to get vaccinated and go through the like, and in light of the recent studies by the Mayo Clinic about cloth masks, and we could rehash the masks and the spores and all that stuff over and over again. But I think what has become more and more evident is that I think in quarantining and contact tracing, I think we're to a point, whether by accident or design or too many politics involved in medicine or whatever it is, that now the reason that people want a mask is because of the quarantine period. So it's because if everybody's masked, then we don't have to quarantine, and it's not about avoiding spread of virus anymore. It's about avoiding this, I'm doing air quotes, this punishment of, okay, we have to mass quarantine. Do you know of any discussion that's happening at the state level about re-examining the North Carolina Safe Schools toolkit about how quarantines are done, and whether or not we're going to get rid of contact tracing because it's so prevalent, or any updates to that? Because it's, if there's any material information that I can take back on that, right? And I know there's probably other people listening that are probably, not in Union Academy, but maybe Union County Public Schools that are interested in that information. If you've heard any talk of how that's going to happen, just because I think, again, right or wrong, we're to a point where people are worried about masking simply to avoid the quarantines rather than spread of COVID.
Yes, it's obviously a big question, big concern. It's a big impact on school settings for sure, particularly as it relates to just the numbers. It becomes very hard to manage just in general with exclusions. When you're having a large number of cases that in and of themselves that you're having to just make sure that they're out for for 5 days, let alone close contacts, and trying to assess that, it becomes really unwieldy. And to answer your question, I mean, the state is aware of this this struggle. I know that I have shared the concern that it's kind of, we've reached beyond as it relates to the contact tracing element. It's sort of beyond its fruitful ability, I think, in this regard. And I think you're seeing it a little bit with some of these changes that was recently made by the CDC and now embraced by the state, by reducing the quarantine time period. I think that was one big step. And quite honestly, I think the next step the only real step to go in a reduction would be to to look at not continuing that exclusion, because you're if you're at 5 days now. If the goal is to just focus on sick folks, stay home, and other folks monitor their symptoms, I think we're probably getting closer and closer to that. So that's a long rambling way to say, I know the state is aware of that concern. They do know the taxing impact that it has on school operations, and I think there's more increasing sentiment to look further at what those protocols look like. It's I think right now with this large surge, it's I haven't heard anything in the last couple weeks, just because the focus has been on trying to embrace this new move or implement this new move to this 5 day level right now. So it's I'm not answering your question probably as directly, but I think there is going to be more to come. I'm just not sure exactly when and how quickly that will happen.
Yeah, no, that's okay. I mean, you can only dispense the information that you have. And I'm sure the closer and closer that November gets, there'll probably be more and more loosening up of guidelines. The closer we get to decision time in November. So I appreciate the feedback, and will you keep us appraised of any changes or information as you get it?
Certainly, we'll certainly do so.
Thanks.
I have a question, Dennis. This is Earl, and
yes.
Thank you for the information, the wealth of information. My question is, the surge, do we know the percentage of those cases in the surge that are Omicron or the Delta, or is it a mix of it? Is it the majority of it is Omicron, 100%, 90%, 80%? Or do we know what that mix is?
I don't know the percentage in terms of actual numbers. What I'm hearing from the state is that Omicron has very quickly taken over Delta as the primary variant across North Carolina. I think we're kind of a living experience of that, with the extremely explosive rise in cases, which is typical of the Omicron variant and what we've seen in other places. So I know that the state in November had the vast majority of almost all the cases that we were seeing at that time were Delta. And so I'm sure there's still some Delta there. I just don't have the percentage, but what I'm hearing is that it's now predominantly Omicron, but I don't have percentages to share.
Okay, thank you.
Any other questions or comments for Dennis? All right, thank you so much, Dennis, for your information sharing. Appreciate it. Just want to do a quick roundtable of our directors before I get to public comments. So if you just have any information that you want us to know about, then I'm just going to go around kind of as I see you on the screen. Jackie.
Good evening. I'm going to be very brief. I know we've covered a lot tonight. My staff continues to support the COVID initiatives with health that are going on. We have seen a drastic reduction in the calls coming into the hotline, and as well as requests for scheduling of appointments, but an increase in the walk-ins that come into the lobby for vaccinations. We continue to do COVID billing. Right now, we're finishing up the month of July, and the revenues to date taken in are $680,799.05. And we are focusing on the budget preparation. Our SL1 based budgets with county targets are due this week. The directors will be looking at SL2s and 3s or expansion items for the budget going forward. And by the 14th of February, we'll have a presentation ready for the commissioners that will include a priority list of all expansion items as well as base budgets. So that's all I have for you.
Thanks, Jackie. Janet?
I just want to thank everybody for their attention through this entire meeting. I know it was a lot of information to digest, and we have a lot of different programs, and obviously this is just scratching the surface of a few of them, but just really appreciate you guys. And Missy, thank you so much for your excellent service as our chairperson. So we're going to miss you.
Thanks, Janet. Stephanie, anything to add? Teresa?
I'm good.
Emily, anything else to add? Michelle McGrath?
Hi, everybody. No, just quickly that, we're seeing a lot of sick kids in our primary care child health clinic and a lot of COVID. So we're actually have moved some of our well child visits to later in the spring so that we can stay wide open with sick kids and keep people out of the hospitals, Missy, and urgent care. So trying to be a good partner with you guys.
Yes, we appreciate it. We've definitely seen our PEDS volume increase. Michelle Mercado?
Hi, good evening, everyone. Happy New Year. It's been a busy 10 days. I just wanted to quickly report we have hit our highest numbers for the week since we closed in March of 2020. We were 96 walk-ins, and last week we were 60. So despite the increase in COVID cases, people are still walking into our office. Earl, I also wanted to speak towards your question really quickly. We are partnering with the Union County Sheriff's Office to provide crisis intervention training, and they've asked Veteran Services to be a part of that. So I know for sure the Sheriff's Office is definitely aware of the mental health crises that are going on right now. Thank you.
Michelle, you got muted somehow. Something went wonky. Now you're back.
Oh, I was finished.
Okay, great. Thanks. Michelle Lancaster, anything to add?
Nothing to add from me. Thank you all very much for your attention tonight.
Tracy?
Nothing to add. Thanks, everybody.
Ashley?
Two quick plugs. The first one, as always, for foster parents. Our numbers in foster children are sadly increasing in Union County. We could use some really good foster parents. The second one being that we do have several openings currently in Division of Social Services. So if you know someone who is looking for a job and would love to work for the most awesome county in the state of North Carolina, send them my way and tell them to take a look at our job openings and apply.
Thanks, Ashley. Commissioner Williams, anything that you want to add from your team for this group? Okay, thank you. Welcome. Thanks for being here. And then we want to move to our public comment section. So we have one person signed up to speak. So each speaker must begin to address the board by giving their name, stating whether they are a resident of Union County, and indicating the municipality which they reside, and if any, stating the topic about which they intend to speak. Each speaker will be given 3 minutes to make remarks. A speaker may not yield any of his or her time to another speaker. Speakers must be courteous in their language and presentation, and personal attacks will not be tolerated. So I think that we have Mr. Schumacher ready to speak, so the floor is yours.
Yes, can you hear me?
Yes, sir, we can.
Thank you. I want to know if you're paying attention to the data studies that are coming out that don't match the narrative. A new study of 145 countries shows that cases and deaths went up after the vaccines came out by 38% and 31%. The Denmark study shows that vaccinated are more likely to get COVID than the unvaccinated. A new study from Germany just came out, shows the higher the vaccination rate, the higher excess mortality. Seems like these would be important to be aware of and to look into. Fauci himself admits that COVID vaccines could make things worse, just as he freely admits the AIDS vaccine made it more likely to get infected and the swine flu caused more harm than good and had to be pulled. Worst case scenario models that have never been close to accurate have been used to create COVID policy, and the actual data has been ignored. Here in Union County, 2 of us went to the records office and looked at every death cert for 2020. Deaths in 2020 went down from 2019. Pretty hard to have a pandemic unless deaths are being reclassified as COVID. With the huge incentives for COVID cases, who's preventing the inflooding of COVID cases and deaths? How many of those counted as COVID hospitalized have had the vaccine? That's a question that I would like to know the answer to. As far as getting back to the records in Union County, the factual number of deaths from COVID in 2020 was 29, less than a third of what the health department is reporting. The average age was 74. The youngest was 41. Only 5 deaths were under 60 years old. The real data does not fit the narrative, so it looks like it needed to be massaged. Scott Davidson, the CEO of One American Insurance, just reported last week that deaths in Q3 of 2021 in the 18 to 64 age bracket went up by 40%. Just to make sure you understand the significance of that, a 1 in 200 year catastrophe would have a 10% increase in deaths. These types of numbers have never been seen before. These shots need to be halted, and an honest investigation needs to occur in order to discover the full scope of the damage being done. Immense damage is being done by these shots. For example, Sean Skelton, a CNA, 2 days after her dose, she started convulsing and can no longer work. Ernest Ramirez has been out speaking about the death of his 16-year-old son after he received the vaccine. 8-year-olds are in the hospital for myocarditis. 12-year-olds are dying from heart attacks. Everest Romney, a 17-year-old basketball player, now struggles to get out of the shower. His mother, Sherry Romney, says she did that to her son. She carries the guilt for taking her son to get vaccinated. It should not be her guilt to carry, it should be your guilt to carry. None of this happens without the healthcare workers going along with it. When you fire able healthcare workers during a shortage in a so-called pandemic, it really shows the depravity of the healthcare industry. Study after study and the data coming in from all over clearly shows that vaccinations make things worse. These need to stop. These are the deadliest vaccines in history. More reported deaths than all other vaccines for the last 30 years combined. Have you guys asked yourselves if you're doing more damage than good? I mean, are you looking at the real data? You're looking at cases and you're focusing on cases which are just positive tests, which don't even reliable. I've spoken to you guys before, and I asked some questions about the money that's coming in, the cases that are being bought with the incentives. How long are those going on? There's not a single comment made about any of the injuries from vaccines.
5 seconds.
There's over 20,000 in VAERS. Not a single comment about the injuries being reported in VAERS. How is that possible?
Thank you so much for your time. Appreciate it. Thank you, team. This has been a long night, so I appreciate your patience and really your attention to all these great and wonderful things that are going on in Union County. Are there any questions or comments before we adjourn?
Motion to adjourn.
Do we have a second?
A second.
All right. Thank you all so much. We appreciate it. And we will look forward to seeing everybody in February.